Hi, everyone. My name is Maggie, and I am the founder of Belter Pouches. And we are starting a podcast series where we talk about caffeine, the myths, the facts. And for this one specifically, we're going to dive into more of a broader sense of caffeine because we all know what caffeine is, but do we know what it actually does? So I also have guests with me. I have my co-founder of Belter to my right.
Yeah, hi, I'm Des Norton. I'm also the co-founder of Belter. I've been working on pouches now for 3 years since I first came across caffeine in a pouch back in Germany in 2022. And I'm really excited because now we're bringing new products here to the US. And, it's all about what we can do with a pouch. That's why also we've always wanted to do the science route, so have research and really understand what we can do. And that's what I think today's about. So thank you for joining.
Okay, sorry about that. And I also have Dr. Green and Dr. Killen with me. So I'm going to start with Dr. Green. He has a PhD and Associate Dean, College of Education and Human Sciences. He's the professor, Department of Kinesiology. Am I correct? Good, glad, because I told you I'd fail that word. And at the University of Northern Alabama, Dr. Matt Green completed his PhD in exercise physiology from the University of Alabama in 1999 with minors in educational research and biochemistry. Oh my goodness, molecular biology. He has received the university award for outstanding research creativity at 2 universities. For Dr. Killen, thank you guys both for being on, by the way. Dr. Lauren Killen completed her PhD in human performance with a concentration in exercise science from Middle Tennessee State University in 2015. She received the university's Outstanding Research Award in addition to the College of Education and Human Sciences Early Career Research Award and Outstanding Research Award. Wow, both of you. Oh my goodness. It's a privilege to have you both on. Thank you so much for taking the time.
Glad to be here. Thank you for having us.
Yeah, thanks for the invite.
Absolutely. So let's get started. It's a hardball question here. So why do we love caffeine so much as a society?
You want me to start? I can start. I just think it's a common consumed product, whether you're a coffee drinker, soda drinker, energy drinker. So to me, it's just an interesting product from just the average person's daily life, but also from us as a research component. How's it beneficial from a sport performance or just performance in general?
Well, I'll add to that too. Coffee has its history, years and years and years. And I'm a huge coffee drinker, so I'm grateful for that. My interest in it goes way back to when I was an undergraduate student at UNA back in the 90s. A lot of caffeine research was coming out, and it was just an interest of mine how a substance that we find in coffee and sodas, chocolate, all the things that Dr. Killen mentioned might have some sort of ergogenic capacity. So, the fact that it's in coffee is really a neat thing because coffee is one of my favorite products. So.
I couldn't agree more. I've had 2 cups today if you haven't realized that yet. But so caffeine's my favorite, huge caffeine user. So we, of course, love coffee and we, of course, love caffeine, but we also hear about the downsides of it. So let's look at the positives and downsides of it if we can tackle those two. Let's start with the negatives and then move into the positives, if that's okay.
Sure. One of the downsides is actually a pretty big myth. Every time not every time, but often I'll say, when caffeine comes up, one of the things that people tend to think is, well, it's a diuretic. It's going to cause you to risk the greater probability of dehydration. Well, we got to thinking about that years ago when I was a faculty member at University of Alabama, and we actually started doing some research on it. And we ultimately, one of our doctoral students completed a meta-analysis. And what we found through that was actually not a surprise to us because we were suspicious of the diuretic claims anyway. we found that the diuretic effects of caffeine, in a meta-analysis, not in a single database study, but in a meta-analysis, they're extremely minimal, almost completely non-existent in males and very, very small in females. And the way I explain that to students is this. We get up every morning, we drink a couple of cups of coffee, as you've already alluded to, and then around 9 o'clock or so, we have to go to the restroom. Well, we link the restroom with the coffee. Well, I challenge them, get up and drink the same amount of water. Yeah. You'll have to go to the restroom the same amount. So I've even had a cardiologist tell a family member recently, stay away from caffeine if you don't want to get dehydrated. And I'm like, didn't you read our article? But anyway, that's one downside. The jitteries, the insomnia, I mean, those are not non-existent. But it does have a huge inter-individual variability. Caffeine does. I can drink coffee and fall asleep within the hour.
Same way.
And other people are the same way. Other people, it does have, more of an insomnia effect, but they vary widely, and some, again, are not as well founded as others. So I'm not sure if Dr. Killen wants to add to that or not.
Yeah, I mean, while you were talking, I was just thinking about, I really wouldn't call it a negative, just a difference in people. Some are going to be more what we call a responder than somebody else. So really just the negatives, or I just maybe call it a difference, is an individual may have more GI distress compared to another person, but that can also depend on the quantity of caffeine you consumed as well. So
one thing that I would add to that too, of course, everybody needs to pay attention to their physician and do what their physician says. The one effect that caffeine does have is it can generate some mild heart arrhythmias, totally harmless in the average healthy population. But heart patients who get told by their physician to stay away from caffeine, to move to the decaffeinated coffee, that's good advice for them, because your heart is not something to be toying around with. You want it hitting on all 8 cylinders. So the diuretic effect, I kind of brushed that off. The insomnia, I've managed to overcome that. But the
looking at your bio, yeah.
Right. The arrhythmias, they're not pretend. And again, we do need to pay attention to what our physician says. So certain populations do benefit from probably steering clear of it, but those are limited.
Perfect. So we kind of dove in. I mean, there's not really a negative, as Dr. Killen said. So I guess actually I want to move on to this one thing, because diving into Belter with Des, I always thought that coffee or caffeine hits you immediately. I was always under the impression that coffee was actually the fastest way for that caffeine high, but then discovering that's not the case. So, I mean, I thought taking a double espresso would get me going in 10 minutes, but why does caffeine take a little bit of time? And why is that such, I guess, like common knowledge for people to think, oh, coffee takes 10 minutes, but it actually takes 45 minutes. So how does that work?
Dr. Killen, you start.
Yeah. So, I mean, we've done a good bit of caffeine research in our field or in our lab here, and it's usually through caffeine pills, and we tell our individuals take it an hour, and that's because it's got to be able to be broken down and absorbed through your GI tract. So it's not an immediate response once you consume coffee or caffeine pills or any kind of food that has caffeine in it. So there is a absorption period where we see it's going to peak, and that's where you'd see the best response with that.
So are people just mixing up sugar and caffeine? So when you take a really sugary drink, you go to the nearest Starbucks and you order everything under the sun in your drink, are people just mixing that up with caffeine? So we know caffeine takes a little bit, but the sugars in the drinks might be hitting, and that's where that thought comes from. You know what I mean?
I think partly it's what we're conditioned to. If I get up and every morning at the same time I'm accustomed to drinking coffee or having a Mountain Dew or whatever the case might be, if I miss that from a psychological perspective, my body recognizes that I missed something that I ordinarily get. So the sugar is absorbed slightly quicker than the caffeine. But as Dr. Killen said, we tend to prescribe 1 hour before anytime we're doing any kind of a trial. We also, to your point, we instruct our participants as they're coming in, make sure you don't eat or drink anything other than what we give you. Because we don't want, anytime we're doing research on caffeine, we try to isolate the effects of caffeine. And if someone takes a lot of sugar, as in one of the designer drinks that you mentioned, it's possible that sugar has either a positive or a negative effect, and it may hide what we otherwise would have seen from the results of taking caffeine. One of the things that kind of links to what you're talking about too, when we have people report to the lab, we have them consume the caffeine per kilogram of body weight and then show up an hour later. Some of the products that I'm seeing today on the market advertise as taking them during exercise. That's one of the areas of research that has really not been expanded very much, and it's going to be interesting to see how that goes. And the reason is, with the Belter product, as we've talked with you and Des, we bypass the GI tract, so the absorption is actually, we think, more rapid. Need to do a little more research on that too, but blood flow to the GI tract during exercise is actually greatly reduced. That's why Mom always told us, don't eat and then jump in the pool. So if we're taking caffeine orally, and that means swallowing it, it's still got to bypass, it's still got to go through the GI tract and pass that barrier to get into the blood before it has any impact. And if blood flow to the GI tract is reduced like it is during exercise, then that may actually mitigate any effects we would see if we take caffeine during the activity. That's yet to be seen. Not a lot of people doing research on that, but I think that'll be something interesting in the future to look at.
Okay. And I believe Des has a question.
Yeah. In my kind of working with Belter, obviously seeing that so many people use caffeine, but particularly in the sports world, it seems that we don't know much about it. As Maggie said, I took for granted that it worked quickly, and we've just talked about it. Most people know actually, and people mention it when there's an alternative. But just going back a little bit, what's your view as caffeine experts generally in the world, particularly in sport? Is it the most used stimulant, most used substance that people know very little about?
Lauren?
I'm sorry, there was a lot of noise on my end back here. Can you repeat your question?
Yes.
Or I can let Matt take it first, and then I can jump in too.
So I come across. So what I was asking, when I went to sports grounds and with sports people, I've seen, for example, people using, say, gels when they're only going to play 10 minutes late in the evening and not get use out of it. In the UK, in our sport, cricket, the one occasion when the game changes and you don't know when it is, so suddenly you got 10 minutes to change from batting to bowling. And we saw our bowlers, go for this pretty heavy dosage of pre-workout. And that's, they bowl for, they were 10 minutes to change, then their kind of stint is done in about 30 minutes. So they're not really getting any benefit. And when we talk to them, we realize they don't eat then afterwards for a number of hours. So swapped in Belter for that. So it's just more a general question. In sports particularly, even though it's used widely, is it not very well understood how you can use caffeine in the best way?
Yeah, I think that's a great question, and I would agree. It's not well understood, and goes back to what Maggie's question was a little bit earlier, in that some people think there's an immediate response to it, but we've also seen people in our lab where, we'll give them caffeine one time and placebo the other, so there could even be something more like a placebo effect, because if they're just playing, they consumed it and only playing for 30 minutes, their body didn't have time to break it down to actually utilize that. So it's really more of a cognitive thought, or what we call, again, a placebo effect of, oh, it's helping me, but they didn't have the opportunity to actually gain the benefit from it before the match was over at that point.
That's a very good point she made. We've done a few, actually not with caffeine, but with some other in some other paradigms. We've done a few what you call deception studies, where we actually lie to people, just to be frank about it, because the nature of the question we're trying to ask in research requires that we kind of mislead people. Otherwise, we won't be able to answer the question. And so the placebo effect is real. And a lot of people, I find, have this preconceived notion that if I don't get to warm up, or if I don't get to do this, if I don't do my competition ritual, I'm bound to fail. And if caffeine's a part of that, then if they feel like they missed that window of opportunity, then it could certainly have a negative impact on their performance. Another, to your point, Des, I think you're right. They being the general public, know it does something. It's a CNS stimulant. That's not hidden. They think it's a diuretic. That's slightly misleading, in my opinion, based on our work. But another thing that I think is probably as big a mystery in the general public is the individual responses. We prescribe and paint with a very broad brush. If you're going to use caffeine, it's best to, if you're taking it in something like coffee, it's best to go with an hour beforehand. Well, somebody may absorb it in 30 minutes where it takes somebody else 45 or over an hour. One person may absorb it very poorly, and in that case, they wouldn't expect any benefit. And there's a little bit of research starting to get going about who should we expect to benefit. Dr. Killen mentioned responders and non-responders. We really would benefit from identifying the people who benefit and why. And it could, there was a study came out a few years ago about the metabolic characteristics. In other words, if you take coffee and I take coffee, the caffeine that's in that coffee, I may metabolize it slightly differently than you do, which is going to have a profound impact potentially on the benefit we might see in sport performance paradigm. So I do think it's misunderstood. Not because we're not making efforts, but research can be time consuming. And every time we answer one question, we seem to create 3 or 4 more we want to take a stab at. So
isn't research fun though that way? You find one answer, all of a sudden you got a spider web of more, and you're like, okay, well, here we go.
Yeah, we'll never run out of something to do, that's for sure.
Oh yeah, I love research. I think it's super fun. So to kind of go off of what you said with people getting hit differently with caffeine, for me personally, I've realized that with caffeine, specifically coffee, belter, even if I'm constantly taking it, sometimes, like let's say today I take I drink 2 cups of coffee, I have a belter. Then tomorrow it hits me different. Is that normal? Is that normal? So where it hits, like all of a sudden it'll hit me in 15 minutes, or coffee will hit me an hour. But sometimes it'll take 2 hours to hit me. Is just because of the amount of caffeine I've had, and I've my body's hit the limit kind of thing? Do you know what I mean? Like it hits me differently.
Well, you bring up a question that just straight honest, don't really know the answer to, simply because in order to answer your question definitively, we would need you in the lab.
I'll get on a flight. I'll see you guys in Alabama.
But it could be, I'll mention a couple of different things, and Dr. Killen may pitch in some other ideas. The timing, if again, you're accustomed to having your coffee at 7, and today because you run late or you had a meeting or something, it's 8, that could have an impact. And also it could have an impact what you take with it. If this morning you just have straight coffee with maybe, minimal cream and sugar, and then tomorrow you have the exact same coffee, but you decide, a Danish would be good with it. Well, you just bumped up the carbohydrate intake, and now your blood sugar is potentially going to have an interaction with the caffeine. So that could have impact. And again, Dr. Killen may have other ideas. Those would be the 2 things I would think first to examine.
Yeah, that's what I was thinking about. But I was also thinking, like when we bring somebody in our lab, we try to keep everything constant other than their caffeine intake, or what we give them, dopamine as we call it. But then I also think, do you feel different because maybe you stayed up late one night and you weren't as well rested, or was there something else throughout your day that made you feel different? And it's like Dr. Green said, we just don't know the answer always. But yeah, definitely a great question to look into.
what I'm kind of goes with the wind. So like one day I'm eating,
I'll add to that too, Maggie.
morning I'm eating only coffee or black coffee. Sometimes I'm having a shot, like I had a matcha earlier.
Yeah.
But it depends. I get, yeah.
One other thing that could affect that too is if you make your own coffee.
Yeah, I do. Yeah.
Okay. Do you grind your own beans?
Yes.
I do too. If you ground those beans a little more fine, the amount of caffeine in the same cup of coffee could differ from one day to the next. Certainly the amount of caffeine in a cup of Starbucks or your favorite coffee shop could vary from one day to the next. If you decide on a light roast versus a dark roast, there's all kinds of variables. So that's why I say we'll never run out of anything to do.
I know you guys have a lifetime of research questions when it comes to caffeine, which is for me, I really didn't put much thought into caffeine until joining Belter, because at first I was like, okay, cool, coffee works, like caffeine pills are great. And then I really started talking to Des about it, and I was like, oh, there's a whole other world for this, which, makes sense, everything. There's always other doors opening for everything. But I always found caffeine very interesting. And the one thing I do find interesting is the crashes. So can we talk about your thoughts around caffeine crashes? Because I've realized with coffee, I do get crashes. With Belter, I don't get as many crashes at all. So is it just kind of like the whole, but my last question where it's kind of like, well, it depends what you ate that day.
Well, I would, people have asked me before about your exact question. And my answer is, well, just don't quit drinking coffee and you'll be fine.
Good.
But,
great answer.
in all seriousness, the crash could be related to what you're accustomed to. The same answer as the onset of the euphoric feeling or the CNS stimulant, the jitters or any other impact. The waning away of that impact would be a similar answer. What did you have with it? If your blood sugar went up because you had the Danish, and then insulin comes in and says, well, I'll fix that, and you get an over secretion of insulin, then your blood sugar is going to crash probably about the same time your caffeine does. So it's possible, at least, that you could be blaming the caffeine crash from coffee on something that is actually an interaction. The Belter, the lack of a crash from Belter could be because there's a slightly lower dosage in Belter than you would find in your average cup of coffee. So we found several years ago, I'll get to a point, just bear with me real quick. If we overdrink water, our kidneys will overcreate urine as a hyper response. Same thing, if we overeat sugar, our pancreas oversecretes insulin and we overfix the problem. So if the caffeine dosage we're getting in Belter is slightly lower, then the body may not take an effort to fix it, and in doing so overfix it, if that makes sense.
Okay. Yeah, that makes sense. Interesting. So I want to move into, we held a little bit of an Instagram story this past weekend asking people to kind of turn in their questions now so I can turn on and ask you. So if there's any repetitive, I'm sorry, but I'm still going to ask them because we have certain people that have questions. So my first question is from Asha in Las Vegas. Is it true caffeine can actually help with memory and focus, or is that just a placebo?
That's a great question. And actually something, one of our doc students is currently looking at a product that has caffeine in it, and he's been doing a good bit of cognitive testing with that. And then we also know from the literature it can help with focus and memory. But then it also goes back to, we always use the answer of it depends in our field. And so I think about like cognitive performance. Is there a peak in which the amount of caffeine we want to consume? Like we typically give 6 milligrams per kilogram of body weight. And so that's a fairly, say, healthy dosage of caffeine there. But are there negative side effects to that from like shaky, tremors? Because that also impact cognitive performance too. So I think it really, yes, there are benefits, I guess the short answer is, but it could also depend on the individual, how fast they metabolize it, but then also the amount of caffeine they're consuming too.
I don't know if you guys are studying this part too, just to like extend it a little bit, but I've always heard that caffeine helps those with ADHD as well. It kind of quiets the mind a little bit, is what I've heard. Is that true? Do we have enough study behind it to know if that's true or false?
I couldn't say 100%. I haven't read those studies, but it does block adenosine receptors in the brain, which means it blunts pain perception. We published a study several years ago where we had people take caffeine in one trial, aspirin in another trial, and placebo in another trial. And in addition to assessing performance in a resistance training paradigm, we also had them estimate their subjective ratings of pain. Caffeine actually reduced pain more than aspirin in that study. Another thing to realize too, it took back to the person's question that went into the internet and asked, if we do a study on caffeine and our question is, does caffeine impact cognition? Just to pull one out of the air. What we have to do is we have to have people show up having not taken caffeine.
Oh.
Okay, well, what we could have done to them, and this is what makes research fun but difficult, what we could have done to them is put them in a poorer position to show cognitive performance. Okay, then when they show back up and we've given them caffeine, well, of course they get better because we kind of handcuffed them cognitively beforehand. So it's very difficult research to do, but I would say it is the question, does our cognition go down when we come off of it, or does it go up when we're on it? And sometimes it's kind of hard to tease out those two things.
Yeah, I just had a question as well. It's more about the sense of how do you use it really well. So maybe in the sports scenario, if you were talking to a particular athlete, say it's an athlete that involves whether it's football or, it's got some sort of aerobic, but it's also a skill factor. Is there something you see most athletes do where you think if they just adopted this type of approach, they've improved their particular use of caffeine?
Dr. Killen, you've worked with a soccer team a little bit, and we did the softball study. I'll let you start at that.
Yeah, I mean, we've done some research with some of our sports teams here. We see a good bit of them are heavy caffeine consumers, and then others are not. I personally haven't seen a lot of the middle ground where they just consume, like 1 cup of coffee or something. They're either heavy consumers or they don't consume any at all. So when we pull those athletes off of their caffeine, or say you can't have caffeine for 24 hours, and then they show up to do our study, they do seem to struggle a little more. So they seem a little bit dependent on that caffeine. Now, going back to like a performance measure, is it more of a mindset because they do consume it on a regular basis, or are they actually receiving benefits from it? And again, that question can be challenging to answer. We try to do our best to come to a conclusion.
One of the studies we did recently had to do with early studies. I'll back up one more step. Early studies back in the late 70s and early 80s dealt mainly with aerobic work, because the mechanism behind caffeine was it enhances free fatty acid mobilization. So in other words, your fat stores would be mobilized, which they have to be put into the blood and transported to the active muscles before they can be used as a substrate for energy production. So Wilmore and Kosler and some of the leading scientists in the world actually did studies early on about free fatty acid mobilization and caffeine enhancing that. Fast forward several years, and some studies started to be published that showed an enhanced performance even when free fatty acid mobilization was unchanged. So at that point, the scientists had to say, okay, well, what other mechanisms are at play here? And one of the mechanisms that is at play is the blunting of pain because of the adenosine, the effect on adenosine in the brain. So fat does not play a huge role in anaerobic exercise, possibly some in recovery, but the main substrate during anaerobic exercise is not fat. But back in the early 2000s, we started doing a few studies on caffeine and anaerobic exercise based on the fact that anaerobic exercise can be extremely painful. For example, doing reps to failure. So we started investigating that, and we have found similar effects in anaerobic exercise as in aerobic. Now, to Des's question, when you start talking about skill, for example, free throws during basketball, pitching during baseball or softball, the question might be, well, if it gives somebody the jitters, might that impair their performance? Well, the last study we did in that little paradigm was assessing softball players here at the university, and we evaluated their pitching accuracy and velocity. We found a very mild increase in velocity, but we found no change in accuracy. My personal belief on that is this: the central nervous input, when we tell our muscles to contract and tell our body to perform, overcomes any potential jitters we might have as a result of the caffeine. It's kind of like, well, I got a hangnail, but also got a compound fracture. I kind of forget about the hangnail because of the compound fracture. My body and my brain my brain is telling my body what to do. And while caffeine may have a small impact, the body can overcome that, much like the effects with diuresis.
So you're talking about accuracy. Funny enough, my next question is from Ben from Houston, and he says, Jake from Glasgow focuses on this. Can caffeine make you run faster, or is it just, as he said, make you run faster to the toilet?
Okay, well, I would caution again the toilet answer, because our meta-analysis shows certainly. Now, if you take it in coffee form, you're getting the liquid along with the caffeine. If you're getting it out of a supplement or something like Belter, you're not necessarily getting the liquid. So I would say no to the run to the toilet, unless it was another GI issue. And can it make you run faster? Well, I'll go back to Dr. Killen's answer. It depends. If he is a responder, and caffeine has a beneficial effect in his physiology, then I would say yes, it has the potential to do that. We have some studies where we've completed repeat 40-yard sprints, and then we've also had some studies where we've looked at more longer duration type exercise bouts. And the answer is, if you are a positive responder, then yes, it can enhance your running performance. Now, it's not gonna put somebody like me in the Olympics. It's not magic. But within a responder, absolutely, it has potential to improve your performance.
Okay. Well, thank you, Jake, for that one. But from Ben from Houston, I always crash mid-afternoon. Is that caffeine withdrawal?
Lauren?
Yeah, that's a good question. I mean, it goes back to, responders, non-responders. What is he used to? Like, how much is he consuming in the mornings? But also,
with the wind.
Right. Like, I see, a lot of our students drinking energy drinks, like these big, tall, I don't even know because I don't drink them, but, it has like 200 milligrams of caffeine in it. And they're like, yeah, I'm crashing. But they stayed up to 3 or 4 in the morning and then had to be at work at 8. So is it due to the caffeine you're coming off of? Yep, that's a possibility, depending on how much you consume that morning and its time of peak. But it could also be other factors that could impact why he's feeling that afternoon crash. Did he have a lot of carbs for lunch and then now he's coming back down? So several factors, but obviously caffeine could be a component in that mid-afternoon crash.
So that was one of our boring lectures too. So.
If you're
don't come off of it and you won't crash. So.
And that was my question. So if you're a responder, let's say you're driving and you've got that kind of terrible tiredness you get. If you're a responder and you take caffeine, is it pretty reliable that you're going to be able to pick up?
Yeah, I would tend to think so. If you're a responder, again, depending on how they took the caffeine. I mean, if they, drink coffee, we still got to depend on about 45 minutes to an hour for a consumption period. So not that immediate effect, but I mean, that's why we, see or hear a lot of people will stop and get a cup of coffee when they're tired and driving to have that pick me up and feel better. So yeah, I mean, there's definitely the possibility if they're a responder, consuming some caffeine can help them get through that travel period.
Interesting. Okay. And one of my final questions, unless you have one more, you have another question?
Live from Instagram.
Live from Instagram. We have Sierra who's with us right now. And if you want to ask the question, you can go ahead.
Yeah, so one of our followers had asked, what is happening when you feel like no amount of caffeine is working? It doesn't matter how many energy drinks, how many pouches, it doesn't coffee, anything under the sun. You're drinking, you're taking in so much.
Are you sleeping?
Yeah, this is just one of those days where you feel like it's just not hitting.
Interesting.
And I know we're kind of having this discussion around a lot of different things around food and sleep and what we're eating, and there's a lot of things to factor in. But I personally have even experienced this as well, where I'm just like, I feel like no amount of caffeine is working. Is the answer still just based around food?
Or sleep?
That day, or sleep?
That's what I'm hearing. Sleep more. Wait, did you guys get the question?
Could you repeat it? Maybe condense it just a little bit. I think I heard her, but I don't want to.
Yeah. So the question is, what is happening when you feel like no amount of caffeine is working for you that day? Is it still just based around food and sleep?
I think Maggie probably in general hit it. How many days do we have where it's a carbon copy of yesterday? For students, it may be, hey, I've got an exam tomorrow, but 2 days ago I didn't have that exam. So my level of anxiety just naturally stress because of other things going on in my life are having an impact on me. Relationships, sleep. Desi's question, sleep deprivation in the military. I think there's an application. There's also a distinct possibility, not even a possibility, I'd say probability, that when a person, and I mean, we can refer to it as a drug, it's not an unsafe drug, but a person takes a drug, they can build up a tolerance to it. Years ago, certain recreational drugs were discussed, and it was like, to get the same high from this drug, and increasing a dosage is required across time because the body builds up a tolerance to it. So it could be that a person could build up a tolerance to caffeine and toss that in the mix with the stress, the anxiety from other things going on in life, sleep deprivation, et cetera, et cetera. And again, the carbohydrate crash that we've mentioned already. If your blood sugar drops, then caffeine's not a miracle. It's not going to fix low blood sugar. That headache's going to still be there.
Oh, yeah. Are you done? Sorry.
I was going to ask a question because obviously I go across from the UK to the US quite a lot. And just your general view on perceptions to coffee and caffeine in the US versus the UK. Because when I open a can of Belter in the UK, the conversation there is very much around sleep. And it's almost like, if it's after 10 o'clock in the morning, it seems to be these days, you can't take caffeine. I think in the culture in the US, there's obviously, I think people have a lot more caffeine in their day. And there seems to be a little less fear around it. I just wondered your perspective, having worked in this area for a long time. Maybe it's more about the American attitude to caffeine.
We love our caffeine.
And maybe the UK fear of its impact on sleep. Is that overdone in the UK press?
I would tend to think so, particularly with timing. If you think of the 1 hour, if we say, hey, your lab appointment is at 2 in the afternoon, well, we would tell you to take your caffeine at 1, knowing that peak is around the 1 hour point, give or take. So if a person is afraid that they're going to not be able to go to sleep, I would say 2 things. The timing of the ingestion is critical, and then also the psychological component, because I've heard a lot of people say, well, I can't drink coffee after 4 o'clock. And I ask them, well, what time do you usually go to bed? All around 10. Well, it's not humanly possible that caffeine has not been metabolized across that 5 or 6 hours. So what I think is going on there is they associate coffee with, I'm not going to be able to go to sleep, and it becomes a self-fulfilling prophecy simply because they've heard other people say, well, I can't drink coffee after 5 o'clock. And so they drink coffee after 5 o'clock, and maybe something does keep them up, and they blame the coffee, just like we blame the coffee for the diuresis and having to go to the restroom, when maybe it's not a fair assessment. So I would tend to think that there possibly is an unfounded fear. Now, again, if you have a 200 to 400 milligrams at 9 o'clock and try to go to bed at 10, you may struggle with it there, and it may be real. But again, we tend to think as we think, so we are. And so if I drink the coffee and I think, well, I'm not going to be able to sleep, then lo and behold, I lay down and I think, well, this is a lost cause here because I drank the coffee. And sure enough, we can't sleep, when if we had just convinced ourselves to the contrary, we probably would have been fine.
I hear that with espresso martinis a lot. So, can be having more than 2 after 5, or I will not sleep until 4 a.m. And I go, now that I've heard this, I'm like, well, that excuse is not valid anymore. But on our final question is from Ellie, and she's actually asking more about pouching and Belter, which hopefully you guys will have the answer to. Are caffeine pouches safe for teens? So let's say teens from, I guess, 13 to 13.
Yeah.
We're going to go with the age 13, I guess.
And then talk about maybe older.
Yeah, and older. Let's go with the age groups really quick on pouching and caffeine. We'll start young first.
Yeah, so I think that's a great question. Just looking at the caffeine content in the Belter pouch. So again, a little bit less than a cup of coffee there. Can we say from a research standpoint, has that been studied in a teen population? No. Okay. But do we have teens consuming coffee and these energy drinks that have similar or even more a greater amount of caffeine? Then yeah, we do. And so I think I don't want to speak or put words in Belter's mouth and then from a research standpoint, because we haven't done that, or at least we haven't personally. But if we're just looking at the amount of caffeine content in a pouch compared to an energy drink, they're probably consuming actually half of that or even less, depending on the energy drink, because some have 200 milligrams, some have a little bit less, depending on which one you're consuming there. So again, I would always think about what they're consuming. And as a parent, that's a decision they need to have, or a question they need to have with their teen. But I would also encourage them, look at other things they're consuming that contain caffeine, just so you have an idea of overall caffeine intake throughout the day. Because I've had softball athletes that are adults, they're in college here, but they're consuming 2 to 3 energy drinks, and they would tell me, well, Dr. Killen, it only has 100 milligrams of caffeine. I'm like, in a serving, but the container or the can is 2 servings. So it's 200 milligrams per that can there. So that would be my point, is just educate parents on what caffeine content is in each product and then what they're consuming overall too.
It's not well known. I agree wholeheartedly with Dr. Killen, and it's not well known. I'll add this in. Some painkillers, over-the-counter painkillers, contain caffeine. And the reason they contain caffeine is because when people get a headache, sometimes it is because of the withdrawal. Well, if the cause of the headache is coming off of caffeine, then adding back the caffeine can alleviate the headache. So it's altogether possible that teens and even younger have taken over-the-counter painkillers that had that level of caffeine. And another thing is, and Dr. Killen kind of alluded to this, I would be very careful about stacking substances. It's pretty well, at least in the United States, and I've never been to the UK, but I know in the United States, we worship sports, we worship performance, we worship gold medals, et cetera, and there's not really a limit to what people will do in order to perform well in athletic settings. And so if I can take caffeine and couple it with Sudafed and a thousand other ergogenic aids, and even if I know it puts me at risk, people will do it. So I would be caffeine in and of itself. I would be hesitant to think it's dangerous, but I agree with what Dr. Killen said, and I think probably the main thing I would suggest for teens, in addition to discussing it with their parents, would be to not couple it with 10 other things if they do decide that it's not unsafe for them, because an interaction is a real thing. It's like when we were getting ready to have our first child, we were said you can clean with Clorox or you can clean with ammonia. But if you clean with Clorox and ammonia, it's toxic. You can't do that. So if one's safe and the other's safe, that doesn't necessarily mean they're safe together. So I'd be very careful of stacking things, especially at younger age.
Gas in their toilets by accident. So,
Exactly.
but
Guys, thanks very much for joining today. You mentioned around research and a bit that depends, and this whole area of caffeine, for me, as I said, I came into it 3 years ago, and it's been fascinating. Would you mind just giving a bit of a short overview on the research that you're doing? We thank you for doing research with Belter, but generally, research that you're doing and where you think the whole area of caffeine is headed.
I'll let you start, Dr. Killen. You're more in the thick of it right now.
Yeah. So in terms of caffeine research, we have done a good bit with our sports team here at UNA. So we've been involved with soccer, looking at shooting accuracy, as well as sprint performance, consuming caffeine. Like Dr. Green said, we've looked at softball and pitching accuracy and bat velocity or batting velocity. And also we had a student athlete that was on the tennis team looking at serve accuracy. So that's been really our focus in terms of caffeine and sprint performance. I personally do a lot in caffeine, but also home exercise is a passion of mine and an interest. And so I've even, started thinking like, what are some ideas that we could do with caffeine and home exercise performance? Because we, see a lot of people go into exercise will take some type of pre-workout or some caffeine component before that. And then we currently have some doc students looking at some other supplements, but one specifically looking at caffeine and performance, cognitive performance, as well as some like physical performance too.
My interest in caffeine overlaps quite a bit with Dr. Killen, and I started studying caffeine, back around 1999, 2000, something like that. And it's been a great ride, and like I've already alluded to, we'll never run out of questions to try to answer. My focus has been, I've had several. One is individual responses. And with Dr. Bishop several years ago, one of the guys I studied with, we came up with a method to evaluate a person as a responder or a non-responder, or a negative responder. We get a few of those every once in a while. So looking at what individual responses look like and what constitutes or why one person responds differently than another person. And also perceptual measures. Most everybody who's engaged in any kind of physical activity has heard of the RPE scale, perceived exertion. And we've shown over and over and over again, very consistently, a blunted RPE response during exercise as a result of caffeine consumption. And that can mean if you're on a treadmill or on a bike at a given intensity, and we ask your RPE very consistently, you'll say about 1 unit lower on a 10-point scale, which is a 10% reduction if you've taken caffeine. I had a softball player a few years ago did her master's thesis, and we actually took people and put them on caffeine and prescribed exercise based on RPE. And they adopted a faster running velocity, running, I think it was a 2-mile bout when they were on caffeine. So the perceptual responses really interest me. Dr. Killen's thesis, you could probably remember the date of that better than I could. She had people take caffeine and do a standard exercise bout, and then 20 minutes later ask them their session RPE, which is a global response of how hard the exercise bout felt overall. and we got about a 1 unit drop in session RPE when people were on caffeine. And they did the same volume of work. We tightly controlled the volume of work, but it didn't feel as hard. So the perceptual responses, and then finally linking it with the Belter product, the delivery mechanism is extremely interesting to me. Bypassing the GI tract has obvious advantages if, in fact, we find similar responses with Belter as we do with coffee or orally ingested caffeine. And also, and I made a kind of a reference to this early on as well, during exercise, we take caffeine before and then they come in there, start their exercise bout. Well, a lot of exercise bouts, for example, a marathon is multiple hours. Triathlons are extremely long duration. What happens when people take caffeine before, but then start to meter it in during the exercise bout? Nobody's going to take coffee with them on the bike or, drink
gels. They're like little gels that they bring. Are those?
I've seen those.
Are they caffeine focused, or are they more, I think, protein focused or something like that?
I've seen them. Are they called goo, maybe?
Yeah.
I think they're called goo. I think they're a combination of caffeine and carbohydrates, very, very rapidly absorbed carbohydrates, which then if you do that, we have to ask, well, which one is having the impact? So, but Belter's ideally developed to actually be taken during exercise. So I think it would be neat in the future to start looking at some performance bouts and research questions and designs where we actually administer it during exercise. I think that would be extremely interesting.
Amazing. Well, do you have any more questions?
Nope.
Do you have any more questions, or anybody from this room? Anybody? Well, this has been amazing. And I think we've come up with more questions for you guys when it comes to your research, which is very exciting. But thank you so much for your time. I appreciate you both. And
thank you very much for talking. Thank you for researching the caffeine, but also including Belter. I'm really excited about that as well.
Yeah.
So we're doing more of these as we're doing.
Yes, please. When you find more answers to my questions, please let me know. We'll have you back on.
Well, our life is questions, so you keep the questions coming, and we won't go out of business trying to answer.
Oh, don't set yourself up. I have a lot of questions all the time, but thank you so much, and I appreciate your time and everything.
Thank you. It's a pleasure to be here, and I thank you for the invitation.
Of course.
Thank you for the invite. We enjoyed it.
Absolutely. Well, thank you. Okay, so that was our first podcast talking about caffeine as a whole. So for our next one, please send in questions to our Instagram at Belter Pouches, and we will feature you in the next podcast. Thank you so much.
Thank you.